With this, I will give the floor to Dr. Tedros for his opening remarks.
Today, WHO is proud to launch the first world report on the health of refugees and migrants. 1 in every 8 people on our planet is a refugee or migrant, and the numbers are growing. With conflicts, climate change, growing inequality, and global emergencies such as the COVID-19 pandemic, more and more people will be on the move. Like anyone else, refugees and migrants have the right to the highest attainable standard of health. But the health needs of refugees and migrants are often neglected or unaddressed in the countries they pass through or settle in.
Today's press conference is focusing on
the WHO World Report on the Health of Refugees and Migrants is a landmark and an alarm bell. It provides a comprehensive overview of refugee and migrant health, demonstrating wide disparities between the health of refugees and migrants and the wider populations in their host countries. For example, many migrant workers are engaged in the so-called 3D jobs: dirty, dangerous, and demanding, without adequate social and health protection or sufficient occupational health measures. The report also highlights a fundamental knowledge gap. Refugees and migrants are virtually absent from global surveys and health data, making these vulnerable groups almost invisible in the design of health systems and services.
We have a special guest today who will talk about this report. And
WHO is calling on governments and organizations that work with refugees and migrants to work together and to empower them through participatory governance, to include them in the data, to prioritize them in research, and to include them in social protection schemes and financial protection in accessing health systems worldwide. Because health for all means all, including refugees and migrants.
Dr. Tedros will shortly introduce them.
I urge planners, policymakers, and donors alike to use the wealth of information found in this report to inform decision-making. I would also like to invite them to consider the action points for governments and other stakeholders around the world to step up efforts and make good health and well-being a reality for all members of society, of which refugees and migrants are an integral part.
From WHO side, we have with us, obviously...
We came under the attack 3 times, miraculously survived those attacks until we made it to the refugee camp. Initially, we started residing in a tent, like so many others, and again, the temperatures were rising up to 45 degrees with 1 fan and a large family trying to use whatever we can to survive. And these are the sort of conditions that are ripe for several conditions, diseases, such as malaria and tuberculosis. Many of my family members, including myself, we got malaria, we survived that, and soon I contracted tuberculosis. That nearly killed me, but also inspired me to become a doctor.
Dr. Tedros, WHO Director General, Dr. Mike Ryan, who is Executive Director.
The conditions that we see in refugee camps now in various parts of the world, they're not too dissimilar to the conditions that I experienced firsthand. Although we were safe from bombs, we were not physically safe, we were not socially safe, and we were not mentally safe.
WHO World Report on the Health of Refugees and Migrants.
In the past 6 weeks, the global weekly number of reported cases of COVID-19 has almost doubled. Deaths are also increasing, but for the moment, not as rapidly as cases. However, more cases means we can expect to see more hospitalizations and deaths in the coming weeks. There are many sublineages of the Omicron variant, most notably BA.5, which is the most transmissible variant detected yet.
As we proceed with the question and answer session.
On monkeypox, almost 14,000 confirmed cases have now been reported to WHO this year, from more than 70 countries and territories. So far, 5 deaths have been reported, all in Africa. Most cases continue to be reported from Europe, primarily among men who have sex with men. Although we are seeing a declining trend in some countries, others are still seeing an increase, and 6 countries reported their first cases last week. Some of these countries have much less access to diagnostics and vaccines, making the outbreak harder to track and harder to stop. WHO is validating, procuring, and shipping tests to multiple countries and will continue to provide support for expanded access to effective diagnostics.
Dr. Tedros will shortly introduce them.